Hello, everyone. Thank you very much for being with us until now. I am honored to introduce Professor Hossein Hesari, Professor of Community Oral Health. He is ready now to start his lecture, and
hello, everybody. It's my pleasure to welcome you all, dear students, and also my colleagues. Today, we start our community oral health panel. Now, we have some lectures, and between these lectures, we have some fillers that we have prepared it for you. I'm Hossein. I'm the Vice Head for International Affairs in the Community Oral Health Department. We start our program with a speech of Professor H.E. Mortoma. Actually, he is visiting professor for our department, and he is in contact with us for about 20 years. And he is the father of community oral health in Iran, and had a significant role in developing the community oral health science and programs in Iran. So after my speech, my comments, I start the next step with a video that is by Dr. Simin Mohebi. She presents about the details of our department, and then we have the speech of Professor Morton. So let's start our panel. First, after that, please, Heiji.
Okay, hello, Hossein.
Hello, Heiji.
Good morning.
Good morning.
Dear friends, colleagues, you hear me?
Yes, but after a video, you will start.
Greetings and respects to all dear dental students. Welcome to the TUMS virtual in-person. This is Dr. Simin Mohebi, Head and Professor of Community Oral Health. It is an honor for me to have this chance to say a few words about our department, academic staff, our activities, and our postgraduate programs. Community oral health disease Greetings and respects to all dear dental students. Welcome to the TUMS Virtual Winter School. This is Dr. Siminzet Mohebbi, Head and Professor of Community Oral Health Department. It is an honor for me to have this chance to say a few words about our department, academic staff, our activities, and our post. Greetings and respects to all dear dental students. Welcome to the TUMS Virtual Winter School. This is Dr. Siminzet Mohebbi, Head and Professor of Community Oral Health Department. It is an honor for me to have this chance to say a few words about our department, academic staff, our activities, and our postgraduate programs. Community oral health discipline is a young discipline throughout the world, I should say. In our country, we started this department from the year 2000 in Tehran University of Medical Sciences. Most of our academic staff are graduated from highly ranked dental schools like Helsinki University and also Sydney University. And some others are graduated from Tehran University of Medical Sciences, which is the first ranked university in the country. We have 8 community oral health PhDs in our department, and also we have 2 epidemiologists and 1 pediatric dentist. With this interdisciplinary approach and the other characteristics that we have, we are almost unique in the neighborhood area, and we offer different educational programs, and we are unique as regards to our research quality and quantity. In undergraduate level, our team offer about 12 credits to the dental students. We offer the community oral health subjects and also preventive dentistry subjects, infection control, geriatrics. We also contribute to community comprehensive care unit and department. And also we offer research methods and scientific writing. Another aspect which may be of interest for you is community-based dental education, which is a new model in clinical teaching. In this approach, the students attend different community fields like schools, kindergartens, elderly and disabled people's institutions, and also psychiatric hospitals to offer the people, the susceptible people, oral health education, fluoride varnish application. They also do the screening and examination and do the referrals. They also attend the public health centers, and they give treatment and prevention under the supervision of the local dentist, which is of great value because they have a real life experience in dentistry in this regard. Considering the postgraduate programs, our team offer 4 advanced training programs. 2 of them are PhD, then we have an MSc, and we have MD-PH course too as a short-term course. The first one is the normal PhD course, in which the first 2 years our students have to study, and we have educational credits. They study and then they go to the research phase. And then the second one is a PhD, which is called a new route PhD. In this PhD, it is not necessary for the student, for the international students, to attend all the time in our country. They can stay in their home country and they just visit our country for shorter period. And the other programs are shorter terms programs, and we can provide them according to your request. For the MDPH, we have an opportunity. This is a special offer according to the coronavirus epidemic. We have changed it to a virtual or blended course so that most of the lessons can be taken as online and offline courses. At the moment, we have more than 40 postgraduate students in our department, among which 5 of them are international students. At the end, I hope you stay safe at your home countries and enjoy our programs.
Okay, now we have Professor Heiki Murtama on the speech. Dear Heiki, please start. The floor is yours.
Thank you, Hossein. Thank you very much. I like to show you some slides. I don't know if you can you see me if I share these with if I share these.
We have your slides. We have your slides right now. We have your screen. Yeah.
Okay. Okay. I just put it in a presentation form. Is this okay? Is it okay now?
Yes, now it's okay.
Okay. Okay. Good morning, everybody. First of all, I like to express my gratitude to the organizers, ever active Department of Community Oral Health in Tehran University, for giving me this opportunity to spend some time with all of you. As we noticed that this new way of being in contact is not so easy at all times. But in the real life, the situation is almost the same. The interpersonal contacts and relations are not always so easy, so we really have to work on that. And certainly, I would be very pleased to see all of you in person, but this is the way it is here on Earth, that we have to do this the other ways, and unfortunately, we do have this virtual contact. Okay. Well, we know that life is very different at the moment, and right now I'm staying at the at my summer house on the archipelago in Finland, and this is just a picture I took last night when the sun was setting at my backyard. Life is quite different, as we all do know. There are some restrictions here in Finland, and unfortunately, we have already started the vaccination program. But certainly, we just have to be patient and wait till everything will be settled in the days to come. But as was presented in a nice video, that the history of medicine as well as dentistry is very, very interesting. And as some of the wise men usually say, that unless you don't know the history, you don't understand today, and you cannot foresee the future. So I like to take you back in the history to take a look at the how our understanding in etiologic aspects of dental disease, oral disease, has evolved in the years. First of all, as we do know that we have trying to act on the basis what is called a biomedical model, which is the model that states that genetic and microbiological factors are the causes for oral diseases. This is something that we have known for quite a many years or decades, and a lot of our activities is based on that kind of approach. But once we understood that the microbiological factors are involved in these diseases, we also started to think about that. What could we do about these microbiological factors? And it took us to the understanding the significance of hygiene, oral hygiene, and that took us to the model, which can be called psychological or lifestyle model, meaning that oral health behavioral factors, they do influence on the health, and certainly that is a scientific fact too. But understanding how difficult it is to modify human behavior in this sense, we have to look broader, and that took us to the model which is called social determinants model, which gives us an understanding that the social conditions and the environment in which people are born, grow, live, work, and age do have influence on health, on as well oral health as a general health. And certainly, whatever we do today, we have to accept all these perspectives to the prevention and understanding the etiology of the major dental oral diseases. But if we think about the oral health and oral diseases, we have to admit that regardless of the technological and scientific developments over the last 50 years, we still do have a lot of challenges. We have a lot of problems in terms of oral disease and taking care of them. If you think about the technology today, we have 3D imaging. We do have microscopes to look into the channels of teeth. We have a robot assisting a implant technology. A lot of things, but still, there are a lot of people who suffer from the consequences of oral diseases, and taking care of that problem. Caring, dental oral health care is the fourth most expensive, causing a lot of economical constraint, even in established market economies. So it's not cheap to take care of oral diseases, as we all know. And unfortunately, whatever we do as a clinical dentist, the clinical interventions account only for a small portion of the improvements in the health of populations. According to WHO, about 2/3 of the dentists are taking care of 1/3 of the globe's population, which takes us to the issue of inequalities in oral health, because those who are most in need, unfortunately, they receive the least of care and least of health education. That seems to be the situation today. Okay, and the last one was that we also do know that the most common oral diseases are both reversible, they are preventable, and it can be done both on individual and community measures levels. Okay, that takes us to the fact that oral health and disease, they should be seen as a major public health problem, meaning that the problem cannot be solved by only individual efforts, even the professional individual efforts. There has to be something else. There has to be another approach to tackle this major public health problem. And what that might be, if you think about the criteria for a public health problem, what is a public health problem? It can be said that it has to be a condition with high prevalence. Is that true for the oral diseases? Certainly that is true for the oral diseases. It has a great impact on the individual level. That's true. It has a great impact on wider society. We talk about the huge economical constraints of taking care of the problem. And we know that this condition, oral disease, most of the major oral disease are preventable. And we do know that there are effective treatments and preventable measures available for this occasion. So what is the problem? We know that we are dealing with a public health problem. It can be identified a public health problem, but we still do have the problem. And if you want to see how the researchers see the situation in terms of developing a population's health, I refer to Dr. Green that already in 1995 introduced the fact that the population's health is influenced by 51% health behavior and lifestyle, 20% by environment, 70% by biological determinants, 12% by healthcare services. Okay, we can argue about the actual percentages, but I would assure you that the magnitude of these factors is quite justified based on the present understanding. And unfortunately, the healthcare professionals, they do have a relatively minor role in influencing population's health. Okay, if we think about the education in public health, what is the situation today and tomorrow? And if we take a look at the Fédération Dentale Internationale, a vision on 2030. In that vision, they state that education and training in public health of oral health professionals of the future will enable them to contribute more effectively to the population level prevention of oral disease. That is just a standing that where we should go. We should train professionals who could contribute effectively on a population level. What else? Council of European Dentists has stated that the education and training in public health will also enable dentists to play a central role in dealing with the future public health emergencies. We are in the public health emergency situation right now, but certainly this will not be the only one. And should there be another one, there's an understanding that and the proper education and training in public health, also the dentist will be able to play a central role in tackling with those problems. And certainly public health dentists are needed to coordinate oral health needs assessments, to implement, evaluate the community-based oral health improvement strategies, and to act as oral health advocates to ensure the closer integration of oral health into wider policies. This is a statement by a very eminent group of scholars in dentistry and oral health, La Cascada group that came out with their declaration stating that the dentistry is in crisis and something else should be done. Okay, all of these are some aspects that relate that it is worthwhile of having another look in dentistry, not going straight into the oral cavities of the human beings or individuals, but coming out of the cavity, looking around, seeing the society, seeing the community, and trying to act accordingly. And certainly this is something that my friends in Department of Community Oral Health in Tehran have tried to do. And after the nice presentation by Dr. Simin, I would also only emphasize that I'm very, very happy and proud of the activities done in the department, and particularly thinking about the undergraduate education. The community activities is something that should be commented. Dentistry is not done and learned and taught only in the ivory towers of dental university, dental clinics. You should really have a real life exposure going there where the people are. I always try to emphasize that it's not a matter of four-wall dentistry we are working with. It's a matter of no-wall dentistry, to go out there where the people are. And as an indication of the international activities and collaborations is certainly the several congresses that have been organized by the department, and also the activities that we are participating today. Okay, a lot of things have been going on, and I just wish that my friends and the staff members of the department keep on good work. There's one more thing I'd like to share with you, that the students who think that where they are with their dental schools, there's one way of finding out what is a present status and quality of your education, and that is being in contact with the AD, Association of Dental Education in Europe, which is a professional organization, has been running on for quite many years now, having more than 160 dental schools or institutions as their members. This organization enhances quality of education, and it has different ways of doing that. One is the journal, European Journal of Dental Education, publishing education-related scientific work. It has also, the organization has come out with a document called the Graduating European Dentist, which states the learning outcomes and gives quite a bit of tools to keep up a modern high-quality dental education. And certainly it also has an opportunity to have some experts to visit of the dental schools to share the expertise and experiences of the professionals. This is something that was done almost 2 years ago with the School of Dentistry at Tehran University. And it is an exercise that needs a careful self-assessment and also a couple of days of discussion with the experts. And based on this visit, I would say that Tehran School of Dentistry really meets the standard of many of the European schools. Okay, you are almost on the verge of looking at the future as professionals, where you should go. This is one way. You are on the porch and thinking what might be the next move. Okay, you might take your journey to the open seas, where the sea is nice and calm. You know where you go. There are landmarks, and you follow the way that has been traditional over the years after the dental education and training. But there is another route. There's another possibility. You might want to chase the view and take a challenge of going a little bit different way. This is the bay I'm staying with at the moment, and you can see that the sea is frozen, and somebody has taken a bath there. And that would be also something that you would like to take. You don't have to go to the unknown, because there are a lot of people walking on this community oral health path. And certainly, I would ensure that that our friends and colleagues in Tehran University, they are more than happy to help you should you want to choose a better look and closer look to the community oral health in a professional future. Okay, I would like to end with Socrates' words that I cannot teach anybody anything. I can only make them think, and I wish I've been able to make you think about your future. Thank you for your attention and enjoy your learning opportunities.
Excellent, Heikki, excellent, and I enjoyed very well. And your lecture was very fruitful for us and was a good beginning for this course, 5 days course. So thank you again, and it was very nice for me to have you, to see you again here in virtual mode, but hope to see you soon here in Tehran as well. Goodbye.
Goodbye, take care.
Hello, I am Dr. Mohammad Zahami, Professor of Community Oral Health Department and the Head of Research Center for Caries Prevention in Dentistry Research Institute of Tehran University of Medical Sciences. I just want to say something about our postgraduate education and international activities. First of all, I want to say that this department
Okay, now we have the presentation of Professor Mohammad Zahami. Dear Mohammad, please, the floor is yours.
Okay, thank you. In the name of God, the compassionate, the merciful. Can you hear me? Do you have my voice?
Yes, that's okay.
Okay, thank you. So hello to everybody, all of the participants of our 2021 Winter School in the School of Dentistry, Tehran University of Medical Sciences. So I'm Dr. Mohammad Zahami. You could just see my introduction in the previous video, but it seems that there was some problem with the video, so you could not see my whole video. Okay, you have lost nothing. It was just about telling something about our department. Okay, so I can see that we have 178 participants. Of course, all of them are not yet students, but I think that's a big number. And in these virtual courses and the virtual classes, it's very important that all of the participants try to be engaged and try to be active. So I start my presentation. It is just like a warm-up in the subject of evidence-based dentistry. I try to do it in a competitive form, so like a competition. So this is just because I want all of you to be engaged, because this helps you to learn what I want to say, what I want to teach in this. I mean, through this medium, it's really important that you are active. So let me share my screen and start my presentation. Okay, so yes, this one. Okay, so can you see my slides now?
Yes.
How I should, yes, how I should change my slides. Okay. Okay, so we want to talk about evidence-based dentistry, just about the principles. Okay, I forgot to thank the previous lecturers, Dr. Mohebi, and also my supervisor and my teacher, my always teacher, Professor Heiki Mortoma, for the nice words and presentation he had. Okay, so we want to talk about evidence-based dentistry. I'm Dr. Mohammad Reza Khami, as you know. So just I want to hold this session as the international competition of evidence-based dentistry. This is the first competition of evidence-based dentistry among dental students was held in 2019. At that time, we had 3 teams from Iraq, Ukraine, and Turkey. They participated in that competition, international competition, of course. So Ukraine team won the competition and they got the highest scores. When they answered the questions, you can find a brief report in my Instagram account. You can see the address here. And what about today? So this is the second international competition of evidence-based dentistry. So all of you are the heroes of your country now. You are fighting for your country. You know that we know that it's virtual. And I really don't know how many teams do we have today. And this is not important because the score of true answer by each participant will be for the whole team. So for the whole nationality. So try to be as much active as possible. So we have just 5 questions and each question has 10 scores, 10 points. So when you answer the questions from each nationality, then you will acquire a score for your country. So don't be passive. Try to not to be passive. So the scores will be calculated and the winner team will be announced at the end of this session. To be honest, this is the first time that I am doing this in virtual mode. So if I then come to the conclusion that it is not effective, then I should go to my slides, just a lecture, and then you will be sleepy and the other problems with just usual lectures. So I'm saying all of these to encourage you to participate in this really competitive competition, because it was very good the first time that we had it. It was not virtual, but maybe the virtual also can work. So the questions will be displayed and then you just raise your hands and then you will have the microphone and okay, we will hear your answer. And according to your answer, you will have a score for the questions that you have answered. We'll continue until we come to the complete answer to each question. So, for example, maybe the first students just have, for example, 1 or 2 points to answer the question, and then it can be completed by the other students, and they can have their scores as well. Okay, so please just raise your hand if you know the true answer. And then about the time, I should be careful about the time. So just let's start with some real life cases. These are not questions, but just for you to come. I want to draw your attention to the topic of evidence-based dentistry and what is it at all. So there are some real life cases. Maybe you have encountered some of these cases during your clinical practice. For example, for vast dental caries in maxillary right first molar of 18-year-old girl, which of the amalgam or composite fillings provide more strength or micro leakage or aesthetic? So three different outcomes you can see here. Or you have done a traumatic wisdom tooth surgery on right mandibular third molar for a 27-year-old healthy man. You don't know if antibiotic prescription is necessary or not. What do you do? Which of the analog or digital radiography systems better diagnose interproximal caries? You can see these are just questions that in your everyday practice you may encounter. A company introduces a device using laser to diagnose dental caries and claims that it is 100% accurate. Will you buy the device or not? You have done a class 2 amalgam filling on mandibular left premolar for a 30-year-old man. The patient asks how many years it will work. What would be your answer to this question? And a 60-year-old male patient with a white lesion in the buccal mucosa asks whether or not it is dangerous. Then again, what would be your answer? Another case, a 25-year-old female patient suffering from halitosis asks what are the possible reasons of her problem. And a 50-year-old female patient with 8 amalgam fillings in her mouth is concerned with potential risk of mercury and asks you if she should replace the fillings with composite or not. Then what would be your answer? Okay, so we want to go to the questions now. Time for competition. So this is the first question. What are the, okay, no, this is not the first question. Sorry for that. These are the problems with virtual classes. Okay, this is our first question. Try to be active for you, for yourself, and for your country. 3 main reasons for being up to date in clinical practice. What do you think about this? I can see, I think, okay, there is a point here that some of my Iranian students are also participating in this competition. So they have attended this course, but okay, no problem. May I ask them if they have attended this course? Please let the other students to participate in this competition because you know the answers. And I can see that you are now raising your hand because you have participated previously in this competition. So please leave it for other students. And thank you. And I will, maybe we can then ask you to complete the answers. That would be better. Okay, so the first, if I can go to the main panel, I cannot see the main panel, but I ask my colleagues to okay, since I cannot see the main panel when I am presenting, I just see my slides. So I ask my colleague Hossein, please manage this so to see how which students would be the first to answer. So the first international student raising the hand. Then please open the microphone for him or her. Does it work? Can you see? Can you see who is the first? No one? But I could see someone raising hands. Yes, okay, now I can see. So, no one?
Hello, Doctor.
Yes.
At the beginning, really, I'm real proud to host, for you to host us, and really thank you for you and your university to host us. And about the answer of the question,
yes,
we can say that you're asked the 3 main reasons for being updated in clinical practice. We can say that at the beginning, we need be updated to know what's the new things, the new technique that we can use for our patients.
Yes,
and
yes,
if there is something new, something from medication, something from the technique that we can add, and in the modern things, the laser is coming. So most of the procedure in modern countries in the laser way. And the second things, we can see more patients, and our hand will be so easy when we are treating the patient, for example, from a lot of department, from a lot of problems, we can see it when we see a lot of patients. So how many patients more we are seeing, how is useful for us to be more practical for our hands and to do it faster. There is a lot of doctors that do their procedures, for example, 1 or 2.
Okay, and then do you want to add anything else?
I'm saying that is really important for all of the students, and not only of the students, even the doctors. A lot of doctors say that, for example, they did the one procedure for 30 minutes. Some doctors, they did one procedure, for example, removing of caries as the second class or third class for 30 minutes. But a lot of them, most of them, they did it for 2 hours, 3 hours. So the reason of it, they are updates in clinical practice, and they are using their hands in many cases. So it will be useful and helpful to them for it.
Okay.
And I wish that my answer will be true. And really thank you.
Okay, thank you. Just you are from Iraq?
Actually, I'm from Baghdad, Iraq.
Yes, Iraq. So thank you for your answer. So the other ones, the other students, please just raise your hands.
Hello, please accept my happiness to be here with you guys. My answer is that except for new ways and approaches to be accounted for, is that we can add something novel and new to the field of dentistry with knowing what is the purpose of being up to date. For example, if a physician or a dentist wants to add something to the field of restorative or prosthodontics, should be aware of what is found by others. What's the problem of the approaches that have been done before? And sometimes the problems of our older approaches are more dangerous, and we can find out what's the problem. Another thing is that you're welcome. This is beside finding new ways, and also being in communication with other scientists to collaborate some new features.
Mm-hmm. Okay, thank you for your answer. And where are you from?
I'm from Iran, Rasht.
Okay, from Rasht, Iran. Okay, thank you for your answer. And then the other students, just we can have one other students to complete the answers because of the time. I'm in a hurry because we don't have enough time. But if just one other students, one other team can complete the answers, please think about clinical practice. Please think about the consumers. Please think about our skills. So what you can add to the first reason that was we should be aware of the new advancement in our discipline. Anyone else?
Yes. Can I?
So just you answered. I want the other students to participate. Thank you. Do we have Neo volunteer?
No, this is the other student. Actually, I raised.
Okay. Thank you. I cannot see the panel, so please continue.
Let me. So yeah, do you hear me?
Yes.
Yeah. I just wanted to say that I'm thinking that it's very important, like for today, to be to have this up-to-date information and to know everything about this one. And your question, I just looked 3 reasons, and I think first of all, it's all about care. Like that's how we can improve, I guess, care of our patients. And there are like we can talk with our patients, and the more we know, the more knowledge we gain, like from day to day. And as we know, dentistry, stomatology is not staying on place, and it's always improving. There are always new things for tomorrow, and that's how we can update our practices, and improve the treatment. We can opt for different treatment methods. And then I think it's also about health. Of course, like that's how we can improve again the health of our patients. And the more we know, I think the more patients know about all these methods, they can they can trust us, and we can increase this trustment from our patients. So I think that's how we can guarantee maybe and to make our patients more confident in our treatment, and that's how we can help them to trust us.
Okay.
So,
okay. Yeah. Okay. Thank you. And you are from Ukraine? Yes.
No, I'm from Azerbaijan.
Azerbaijan. Okay. Thank you. So, okay. Because of the time, in our 4 remaining questions, we will here just answer by one student, and then we will complete the answer because I have some slides after these questions to complete the class. So, okay, this was the first, and we have 3 participants from Iraq, from Iran, and from Azerbaijan, and they have got their scores for the team. And then, so the second question. So because we have just one answer, we will have just one answer, so please be careful. So what are the main sources of information? What are the main sources of information in our daily clinical practice? So please give microphone to those who are volunteer to answer. Just one. The first students raising the hand.
Hello, good morning.
Hello.
It's Khawla from Tunisia. So the main sources of information for dentistry students, I guess, are courses, academic, university courses, of course, internet, and I think it's the second, which I find, which I do not agree a lot, actually. But at the third, I guess, literature and books that are not always available in all the countries. Thank you.
So you said online, courses, university courses, and then books.
University courses. University courses, internet, and then books. But
okay. Thank you. And you are from Indonesia?
Tunisia. Tunis.
Indonesia. Okay. Thank you.
You're welcome.
So. Yes. Then we will go to the next question. What are the types? Yes, this is the next question. What are the types of the questions in clinical practice? Please just think about the cases that we saw in the beginning of this presentation. In which areas they were. So you can think about the main domains, the main types of the questions in clinical practice. Okay, who wants to answer this question? Yes, the third question. We'll have 2 more.
Raise your hand, please.
Okay, then, okay.
Nurham.
We have 1 volunteer, so please.
Yes. Ahmad Amiri. Yes. Okay, Ahmad.
Hello. This is Ahmad Amiri. I am Iranian, and according to the question, what I understood, basically the question would be, what is the chief complaint of the patient who came to the dental office? Like why he came here or why they came? This is, I guess, this is the first thing I would ask the patient, like the reason why he came to the clinic. What else? What other types?
Just think about the questions that the patients ask us, not the questions that we ask patients.
Yes, all right. So yes, probably most of the cases they probably will ask about. They are like confused about the reason why they are having such a pain, or if this like procedure it will be painful, or sometimes like if he can have an immediate treatment because he's probably in pain, or sometimes he's coming and asking about a restoration he already has, but he's like seeking for some consultation about it. Like probably he wants to, there is some mistake about it, or it's not being okay because probably there's some kind of shrinkage and maybe leakage or discoloration. So many, yeah.
Mohammed, the time is over, please.
Yes, okay, I know that we have in the shortage of time. So just not forget about this question. Just we go to this question as the last question. So just please, one student, please answer this just one question, and then I just want 3 minutes to complete my lecture.
Okay, that's okay.
Possible?
The steps of EBD.
Yes.
Who raised your hand? Somebody should answer. The first one is who is? The first one, okay, Nushin.
Hello, doctor.
Hello.
First, I wanted to thank you for this amazing seminar. Okay, so I think, first of all, it must be asking, for example, turn your clinical problem into a question. Then it's supposed to be accurate, for example, search for the best evidence, see the pictures, and check in the mouth, I mean, the patient mouth, then appraise for like critically appraise the evidence found, and then apply the results of the appraisal into the clinical practice.
Okay, thank you. Almost complete answer. Thank you for your participation. So I just try to complete your answers because we are in shortage of time.
I think it's supposed to be assessed as well, right?
Yes, yes, the last step would be assess. The answers that we have found. Okay, just our first question was about sources of information. So as you mentioned, some of them teachers in the university, then textbooks, then journal articles. Now there is an increasing trend towards web-based courses and information. Then why being up to date? So you mentioned information explosion and that we should be aware of the new techniques, but we have two other reasons. The slippery slope of clinical competence phenomena, meaning that expertise and effectiveness in some areas begin to deteriorate the moment the physicians leave medical school. And about the consumer movement, patients are starting to come to their dental appointments with information downloaded from the internet, some of which may be unfamiliar to dentists. Then just some word about information explosion. These are the statistics of 10 years ago, but you can see how many information are produced, how much information is produced today in every day. So you can see the numbers and the figures. I don't want to repeat the figures, but this RCT means randomized controlled trials, not root canal therapy, of course. So you can see these are statistics regarding 10 years ago. And then the doubling time of biomedical sciences have been 19 years in 1991, but 20 months is in 2001. And that there is some estimation that the general practitioner needs to read 19 articles every day to be up to date. So some other statistics about the doubling time of medical knowledge. It has been 50 years in 1950, but 7 years in 1980, 3.5 in 2010, and now it is just about 73 days in 2020. So you can see the speed. So the students who began medical school in the autumn of 2010 will experience approximately 3 doubling in knowledge by the time they complete the minimum length of training, 7 years, needed to practice medicine. And then some other statistics, just skip these. You can have my slides and you can see them. These are just some statistics about information explosion. And this is this is happening from one article. Then you can see the figures of the number of articles in PubMed and in Medline database. With the mesh term of dentistry, you can see the number of articles. And the problem is that not all of this information is valid or useful for patient care. Just a little more than 1% is both rigorous and clinically relevant. So most research published in medical journals is too poorly done or insufficiently relevant to be clinically useful. And we know that we have conflicting findings. So we come to the definition of evidence-based dentistry. It has three main components. So evidence-based medicine, evidence-based practice, evidence-based dentistry is the integration of best research evidence with clinical expertise and patient values. This is another definition, again, with those three components. I don't want to repeat, and you can see that the most valuable application of the evidence-based approach is the practice of dentistry to encourage the dentist to look for and make sense of the evidence available in clinical practice. These are the 4 steps of evidence-based dentistry that one of the students nicely mentioned. First, we should define a clear question, then we should try to find the answer in the literature. Then we should be able to critically appraise the data information that we found. Then we should act according to the answer that we have found, and then we should evaluate and assess what we have done. So I leave the other because this is my colleague, Professor Reza Yazdani, will continue this with the formulation of clear and focused question. Thank you for your attention. We will continue this, and then I will have some other things to tell you tomorrow. Thank you for your attention.
Thank you, Mohammed. That was very nice presentation. So after a break, we start with Dr. Yazdani. Okay.
Farid Farokhi, and I'm glad to be a part of Community Oral Health family as a third-year resident and also chief resident of department. My research project is about oral health educational content for healthcare personnel. Hope to see you soon here.
Okay, now we have Professor Reza Yazdani. Reza, the floor is yours. Please start.
In the name of God, hello to everyone. Welcome to this session. I hope I had a good time for presentation of my colleague and this virtual webinar. In this session, I briefly explain about PICO question and PICO models. Before you start your search, it is very important to have a well-built question. One way to construct a well-built question is to use the PICO model. PICO model stands for patient, population, intervention, comparison, and outcomes. With the PICO model, we design a question for starting our evidence-based dentistry procedure. For this reason, it is very, very important. As you see in this slide, we have 5 steps for evidence-based practice and evidence-based activities. The first step, and I think the most important step, is designing a question. Ask. We must change our information to a question, but it is very important to have a clear and precise and answerable question. It is very important. General question is not useful for us for evidence-based dentistry. As I told, we need a clear question. After designing a question, the next step, acquire. We should find, according to search, answer for our question. Then appraise. We should appraise the evidence. Unfortunately, we have a lot of low quality evidence. For this reason, we should appraise the evidence and choose the best evidence for applying for solving our problem or for our patient. And the last step is audit. We should evaluate our intervention or response to questions. As you see in this slide, for finding the best evidence, we should formulate a PICO question, then search secondary sources or filter primary sources. According to this activity, we should find the best evidence. As you see in this slide, it is very important to design a clear and focused question for starting evidence-based dentistry. Our field of question are very different. For example, in therapy field, in diagnosis, in prognosis, in causation. For example, in therapy, what technique is most reliable? Which material is superior? What drug should I prescribe? Diagnosis, is this test accurate or reliable? In prognosis field, what is the patient likely clinical course over time? What is the expected longevity of this restoration? About causation, what is the etiology of this condition? And so on. Okay, according to PICO, as you see, PICO has 4 letters, P-I-C-O, for 4 words. P for patient or problem, I for intervention, C for comparison, O for outcomes. Of course, sometimes we cannot use comparison, but PI and O complementary for evidence-based question according to PICO model. As I told, the first letter shows patient or problem, starting with your patient. Ask, for example, how would I describe a group of patients similar to mine? Be precise, yet brief. About intervention, which main intervention am I considering? Again, be specific. Comparison, what is the main alternative to compare with the intervention? And the last letter, the last stage for PICO is outcome. We should clear our outcome for our intervention or solving our problem. I prepared some example to show that how can we design a question based on PICO model in evidence-based dentistry. For example, we have orthodontic patient with orthodontic appliance. As you know, orthodontic patient has high risk for dental caries. In this condition, our P is orthodontic patients. Our intervention is professional fluoride varnish plus home fluoride toothpaste. We want to compare our intervention with home fluoride toothpaste, and our outcome is caries incidence and occurrence of caries. It is very important. Okay, we have orthodontic patient, and we want to manage his or her caries incidence. Other question, sometimes we use fissure sealant for preventing dental caries. In this condition, for example, we have patient, our patient are children with a sticky patch in the secondary teeth. Our intervention is fissure sealant, and we want to compare our fissure sealant with no sealant, no intervention. Our outcome is caries development and side effect. We want to evaluate caries development and side effect. Then we compare fissure sealant as an intervention with no fissure sealant when we want to manage dental caries in secondary and permanent teeth. Okay, another question. The case for extraction of deciduous maxillary canines in children with palatally ectopic maxillary canines. Our patients are children with palatally ectopic maxillary canines. Our intervention is extraction of deciduous maxillary canine. Our comparison is to compare no extraction of maxillary deciduous canine. Our outcome is improved eruption permanent canines. As you see in this case, we have ectopic canines, and we want to manage ectopic condition of the permanent teeth. In this case, we want to manage with extraction of deciduous maxillary canine for managing our problem. Another question in periodontal disease, as you see, we have patients with severe periodontal disease with bony defect. We want to treat this patient. Our patient, as you see, are adult periodontal patients with bony defect, with bone resorption. Our intervention is periodontal surgery with endogain. Endogain is matrix of enamel. We want to comparison this intervention with periodontal surgery alone, without any use of endogain. And outcomes, we want to evaluate probing pocket dips, probing attachment level, quality of life, and adverse effect after intervention. Okay, in the last slide, you can see as I told before, we have 5 steps and 5 stages for evidence-based dentistry. The first step is designing a question, but however, we need a clear question. For having clear question, we need a model. I explained very shortly about PICO model. For clear question and for answerable question, we need to use PICO model. We should have our patient, our intervention, and comparison and outcome in our question. In this way, we have a clear question and we can find the evidence, the best evidence. Unfortunately, general question don't help us. For this reason, we need, again, I repeat that we need a clear question. After finding the evidence, as I told, unfortunately, we have a lot of low quality evidence. We should critically appraise the evidence, and during this procedure, we can find the best evidence for our patient or for our problem. After finding our answer, we act usually for patient or for solving the problem. And in the end, after acting, we should evaluate our intervention for future patient or future answer to our seminar question. Thank you very much for your attention. I have time.
Thank you, Reza. Thank you for a nice presentation. If any of the students have any question, please raise your hand. Otherwise, we continue. I'm waiting for any question. Okay. Thank you, Reza. And we continue with other presentation. Okay, one hand. Wait. Okay. Nur Hamid. Okay.
Yes, Victor, do you hear me?
Yes.
I have one question, please.
Okay.
At the beginning, if we wanted to write research, what's the steps that we should do it? For example, we are beginner and we wanted to write the research. What's the steps, the important things to make us to be the ability to make us to make the research? The first step that we should do.
Usually we start with a problem. For example, we want to fill the teeth with amalgam or composite. This is our problem. Which one is better for our patient? After this problem, as I told, I think we should design a question, clear question. After that, as you saw in the slide, we search, we find evidence. Unfortunately, we have a lot of low quality evidence. We should appraise, and after that, we can use the best evidence for solving our problem or for patient.
For example, before 2 months, I did one research. I'm the beginner, I'm students. I did one research about the effect of smoking on the teeth and of the composite, the restoration.
Okay.
I went to clinic with one doctor, and I took some photos, some pictures of the patients to the teeth, and what's the difference between the normal teeth that the people that not smoking and the people with smoking. And I detect all the pictures. Now the pictures with me. What should I do more to improve my my research?
Okay, I think you have some keywords for activities, and use these keywords for finding your evidence. And there are a lot of, I think, evidence, for example, as you said, for smoking and discoloration of teeth. According to your keyword and your question, you can go to, for example, PubMed. You PubMed or Google Scholar. According to your keyword, you can find a lot of things. But for us, the best thing is articles, high quality articles, for example, systematic review, if you find, or randomized control trial, if you find, is the best evidence for answering your problem.
Could you please repeat the sites? Sorry. Could you please repeat the sites of computer that can I search on it?
PubMed.
HA.
Write it.
PubMed. PubMed. Okay. National Library of the US.
Okay, thank you.
I really appreciate you. Thank you very much for this rich information. Thank you so much.
You're welcome. You're welcome.
Okay.
In the name of God, hello. I'm so glad to have this chance to take part in this international event. I'm Dr. Zahami. I'm a dentist and currently a PhD candidate in community oral health. Now I'm working on my thesis project entitled an educational intervention by community health volunteer on household women in deprived remote areas in a province located in southeast of Iran. I appreciate your attention and best wishes.
This topic is the second step between 5 steps of evidence-based dentistry. After forming answerable question that Professor Yazdani present before me, we are in second step that's searching the evidence for evidence-based practice. You can find some basic topics for searching in internet and in resources. And I present here 5 steps for basic search in internet. The first one is to provide precise questions that we can drive the specific keywords related to our topic. The second is to determine the level of evidence that best answers the question. As you know, we have some areas and some dimensions in evidence-based practice. I mean, for example, your question is in the field of therapy, or your search is in prognosis, or in prevention, or in diagnosis. And if you know the level of evidence, I mean the best level of evidence for these dimensions, you can directly go to the specific data sources to get the best answers about your question. For example, in case of therapy, we know that the best answers are provided by systematic reviews of randomized controlled trial. I hope that all of you know the type of researches, I mean, randomized controlled trials and systematic reviews.
Okay, but if I don't know what is that, could you just rename it?
Yeah, about the systematic reviews? Good.
Yes.
We have 2 main types of research studies. The first one, primary studies that we can find in the articles as original article, and we have secondary studies that by second studies, we gather the primary studies and summarize them as a article. We name them systematic reviews and meta-analysis.
Thank you.
Yeah, you are welcome. And if our questions are related to the prognosis of patients, it's not possible to perform clinical trials to get answers to these types of questions. So we should know that the best evidences in prognosis area are the good performed cohort studies, not randomized clinical trial. So knowing that the type of questions and the area of the question is very, very important for searching. The third is we should select the best relevant databases for search. For example, if we want to search the highly validated systematic reviews, we should go through Cochrane database, for example, and so on. And from the PICO questions, we should provide some keywords, and then we should streamline our search by the tools, the resources, and search engines provide for us. For example, using mesh terms in PubMed, or using Boolean connectors such as and, or, not, with in other search engines, and we should and we can use filters and limitations in different search engines. So we should know how to search in each search engine. For example, for Cochrane, there is a how to search in Cochrane Library, for example. This is the interface of the hub web page for Cochrane Library. And here is the tutorials provided for PubMed for getting best results in this site. Here we have some PubMed online training, and there is some documents for trainers. Okay, I want to find that you know the differences between a specific search and sensitive search. If you want to start searching in a database, are you prefer to search specific or sensitive? Please send 1 for a specific search and 2 for sensitive search.
Okay, somebody told 1.
Good.
Should raise hand or just answer the question, number 1 or 2?
All participants could send the numbers of favored options, and if anyone wants to define a specific search or sensitive search or the differences, can hand raise and
Hossein, do you like to say something else or just to answer 1 or 2? If you have something else, raise your hand. Otherwise,
yes. Is there any volunteer?
All of them answered 1.
Good, good. All of them are 1. Okay. So the answer is it depends. So it depends on what. A specific search may be put us directly to the right answer, but we may miss some evidences about our question. So I prefer to start my search with a sensitive search, and then after, according to the feedback I will get from the, for example, the search engine, I decide, is it necessary to narrow or to specify my search or not? It's enough. So there are some tips for increasing the precision or specificity of search, and there are some tips to increase sensitivity. For example, if you use fewer keywords, for example, here it says that we can use cancer, chemotherapy, and nausea, or we can use only chemotherapy and nausea. So using 2 keywords provide more information and more evidences, and it became our search more sensitive. And if we get irrelevant information and evidences, or if we get huge number of evidences, it's better to narrow more and use more keywords, or we can only limit our databases to the best search engines that provide us the best evidence for that question. Anyway, there are some level of evidences you can see in different web pages and references. We have 2 types of information. Some of them related to primary studies, case control studies, cohort studies, and randomized control trial, or secondary studies or appraised evidences that we name filtered information, such as systematic reviews shown here, and some evidences above systematic reviews that are provided in, for example, clinical guidelines or some applications and systems. Okay, to start your search for evidence-based dentistry, not for writing a proposal for research, just for evidence-based dentistry, you should start from summaries and systems at the top of the pyramid of the evidences. And if you can't find the information in summaries, continue down the pyramid. For example, here is a three-step search, which starts with those resources that provide clinical guidelines. There are some examples here, and there are some links and web pages you can review after my presentation. And here is the second one. If you find your answer in guidelines, is okay, so your search is finished. Otherwise, you should go through the second step to search in Cochrane Library for systematic reviews or non-Cochrane databases and so on. And finally, you should rely on primary studies in Medline or PubMed, for example. And the last one is referring to an expert. So the first one is for the top of the pyramid, the second for middle of pyramid, and the last one is for the base of the pyramid. So this is another question. What are the benefits and risks of using antibiotics as well as cleaning by a dental care professional to treat gum disease? It's a Kiko question. So if you want to start searching the answer to this question, which one is preferred, Cochrane Library or PubMed or Medline? Please send the answer again. Okay, Dr. Hassadi, can you tell me what about the answers? Because I can't see. I have read that I lost the screen. Good, one. Okay. So this question is Cochrane Library. If we have no guidelines to answer this question, then we should go through Cochrane Library and then after to PubMed or Medline. Thank you very much. Here is the interface of Agency for Healthcare Research and Quality is related to the US. There are some clinical guidelines. Here the interface of a NICE web page is related to the UK. Here the interface of Cochrane Library, and you can see there are a branch of related to oral health. So it's more specific for searching in Cochrane Library. And here is a nice web page named TRIP, turning research into practice. As other web pages, there are a box for search, and there is a Pico search format that you can put your keywords in a specific boxes, but your search is not specific for the population or intervention or comparison or outcome, but it's organized your search better than other web pages, and the output of the search is shown by the somehow the level of evidence. For example, this evidence is related to primary researches. The second one is a systematic review, and the last one is an ongoing systematic review, for example. Here, another web page, the Dental Elf, you can see some general guidelines for practitioners or for population, and another web page, Epistemonicus. Like this, you can search for some topics and guidelines here. You can see the categorization of the search outcome, broad synthesis, number of systematic reviews and summaries, and primary studies. So you can see the high quality evidences are less than primary studies, for example. And also here, they provided some filters for dates. And the last web page that I want to introduce is some search 2. Also, they provide some filters for intervention or diagnosis, or all of the information, or for age, those questions related to the adults or pediatrics, language limitations, and so on. And here, for example, you can see they provide, for example, guidelines, systematic reviews, and original studies, which the guidelines is best for answers. If there is no output, you can go through systematic reviews, and finally through original studies. Okay, it's my last slide, and I'm here to ask your questions if there are any.
We have some minutes left. If you have any question, please raise your hand or write in the chat box. So, no question? Okay. Okay, just very shortly, please.
Yes, doctor.
Good question.
I want to ask the doctor one question. What do you mean by systematic reviews?
Again?
What do you mean by systematic reviews? There is some research, primary reviews, and systematic reviews. So what do you mean by systematic reviews?
Okay.
Okay. Systematic reviews, as I mentioned, is a study of primary studies. For example, if you search and find numerous evidences about one topic, all of them provide different results. Some of them say that A is better than B, and some say that A is equal to B. Some researchers perform a secondary study and gather all articles and then appraise the articles and find the best one, and throughout those primary studies with critical weakness, and they pooled all good resources to find just one answer.
Okay, thank you.
So, for example, yeah.
Another question is that the upper one. No, upper one.
Okay, another question is that which database do you explain about in slide 39?
39. Okay.
Yes.
This one is for, can you see my screen?
Yes, that's, so now it's okay.
So this slide is for Epistemonicus webpage.
So that's a bit difficult, its name. So you can write the name, the chat box. The other question is that, can a dentistry student write an article by himself or herself and can publish it or not?
Yes, of course. Our students in TUMS, I mean, Tehran University of Medical Sciences, after finishing their thesis, they going to write the paper and will publish by their supervisors. Yes, of course. But advanced evidences, for example, I mean, systematic reviews is difficult and it's be performed by postgraduate students.
Okay.
Yeah.
And thank you, Ahmed, for your nice presentation. And if there's no question, we'll finish this session and then another short answer, please. Can you please explain the difference between cohort studies and randomized cohort trials? So do you explain it later or can you answer it very shortly?
No, I can say. The cohort studies are very similar to clinical trials, but the main difference is the intervention. In cohort studies, we have no intervention, and the researcher only observed the exposures and outcomes. But in the clinical trials, the researcher performed the exposure by himself. So we name the exposure as intervention. So it's highly controlled and is highly valuable and valid studies to relate the intervention to the outcome, and it's more near to causation, not association.
Thank you.
Good question.
Thank you very much. Finish off your presentation right now. Okay. For the next part, we have Professor Mohebi. If we have the, okay. Hello, Professor Mohebi. The floor is yours. Please start because we are in shortage of time. So thank you.
Thank you, Dr. Hessari. Good time and good day to everybody. I hope that everyone has enjoyed the program so far. Do you have my voice and video? Is it okay?
Everything is okay.
Okay. Thank you. Now that our dear students have learned something about evidence in dentistry, we are going through a short lecture on the role of oral hygiene in prevention of dental caries. Okay, sorry for the interruption. We are going through a short lecture on the role of oral hygiene in prevention of dental caries. Let's see what the literature tells us in this regard. By oral hygiene, we mean the mechanical removal of plaque. Okay, in this lecture, we have an introduction, a short introduction, then we go through some theoretical consideration, biological effect of tooth cleaning, then we go through clinical effects of tooth cleaning, then we have the effect of professional tooth cleaning, and at the end, we have some concluding remarks. As all of you know, motivation and instruction in oral hygiene form the basis of school-based caries preventive programs and for all caries preventive programs. 80% of 11-year-old school children in Scandinavia report that they brush their teeth at least twice a day. Daily toothbrushing with fluoride toothpaste is believed to be the primary reason for the caries decline observed in many populations. Saliva is decreasing sharply. But in the right hand, the same person is rinsing the solution after plaque removal. Again, we see a decrease, but it's not so sharp. So even after carefully performed plaque removal, teeth are never clean from a microbiological view. Bacteria will often be retained in surface irregularities. Let's go to the clinical effect of tooth cleaning. Before we start to go through the literature, you may encounter two words when you are working on the effect of an intervention. You may hear about efficacy of an intervention or effectiveness of an intervention. Efficacy refers to the ideal situation. It is when you have a controlled condition, you are working on at the individual levels, everything is under control, and you see that can the procedure work or not. And then we have another term, effectiveness. It is at the population level. It tells us at reality what will happen. Does the procedure work or not? So it's important to take care of these two words. For example, if I want to give a general example about the vaccines, the coronavirus vaccines, whatever you hear is about their efficacy. And then we should know in future that what will be the effectiveness of these vaccines on the population. Okay, let's go through the ideal situation at the level of individual. There is a study, a main study in this regard. It is studying the effect of daily supervised toothbrushing in groups of 9 to 11-year-old children over a 3-year period. As you see, we have 5 intervention groups. The first group have daily supervised toothbrushing with fluoridated toothpaste. The second group have daily supervised toothbrushing with a non-fluoridated toothpaste. The third group have fortnightly rinsing with NaF solution, and the other group rinsing with distilled water, and we have a control group 2. And here you see at this total column, you see caries increment during the final year of a 3-year experiment of different preventive
measures in here. As you can clearly see, daily brushing, the first row, daily brushing with fluoride toothpaste was more efficacious than the other interventions. And then fortnightly fluoride rinses reduced dental caries, increments here, you see. And one thing which is very important in this slide is supervised toothbrushing with a non-fluoride toothpaste did not appear to have a detectable effect. As you see, it's almost the same as fortnightly rinsing with distilled water or even the control group. So the key findings are biofilm removal or plaque removal and fluoride when acting together have an additive effect, and poor oral hygiene cannot be compensated for by the intensive use of just fluorides. For example, the effect of professional administration of fluorides in the form of rinse, gel, or tablet has been shown to be limited in individuals who do not practice good oral hygiene. But what happens at the population level? Okay, at the population level, unfortunately, self-performed toothbrushing is not particularly effective in decreasing dental caries. It is hardly surprising that there is no clear-cut association between oral hygiene and caries in population studies. Some researchers even believe that primary purpose of toothbrushing is that the toothbrush serves as a vehicle for application of fluoride. Anyway, please keep in mind that toothbrushing is cheap and easy to implement, and it has the potential to control both caries and gingivitis if it is done properly in the correct way. As you have seen in the efficacy studies, it showed some effect together with fluoride application. Okay, another item which is very important is the interaction between plaque and diet. As you see in this slide, we have a figure here. It shows the risk of dental caries in different plaque accumulation and sugar consumption amounts. This light blue column is about low plaque risk of dental caries in low plaque accumulation, as you see here. And then we have the purple one, moderate plaque accumulation, the risk of caries in moderate plaque accumulation. And then we have dark blue. It is the risk of caries in high plaque accumulation. And we have 3 amounts of sugars in here, if you can see it. As you see here, when sugar consumption is not low, I mean moderate and high, biofilm removal can be a powerful method to control the development and progression of caries. As you see, this slope is very steep. And then another important question, a key item, a key sentence, as I can mention, at low levels of biofilm, as you see in these light blue columns here. At low levels of biofilms, an increase in the total sugar consumption did not increase the risk of caries notably. So that if we have a patient who is good regarding oral hygiene, if he eats a bit more sugar, that does not increase dental caries in him. Okay, let's stop here and take our time to think about it. Do you think that you can recommend unlimited sugar consumption to the patients with good oral hygiene based on these results? If someone wants to answer, please raise hands. Dr. Hesari. I can see your hands, but
nobody raised hand yet. Okay.
Okay.
Anybody?
May I repeat my question? Do you think that you can recommend unlimited sugar consumption to the patient with good oral hygiene? Based on this diagram, it was shown that people with good oral hygiene, I mean high plaque removal, good plaque removal, they don't have a lot of dental caries, okay? Can we or do we recommend unlimited sugar consumption to the patients with good oral hygiene?
Please answer. Okay, Noor Hamid.
Noor Hamid.
Okay. Okay, start please. And after that. Okay.
Do you hear me?
Yes. Yes, start.
Hello, doctor. And I think no, doctor, we can't recommend it. We can't recommend to the patient to have like a limited amount of sugar because we don't know which amount of sugar will affect on our teeth and make the caries.
Okay, thank you. Next one.
Thank you.
Hello, I think it is much better if we advise the patient if they have like if they have like, let's say, good oral hygiene, the sugar can affect even by like the short period of time or long period of time. Sugar can affect, so it is very advised to the patient to tell them like to reduce the intake of sugar.
Okay, thank you. Anybody else? And yes, I think we should. Sharifi, Ahmad Sharifi. Okay, the other one. Okay, thank you.
Okay, thank you everybody for the contribution. Okay, I wanted you to mention something else. As we are part of the health team, we do not recommend something which is in controversy with our medical colleagues because sugar is also a common risk factor for many other medical conditions such as obesity, heart disease, diabetes. So we take a common risk factor approach with all the medical team, and we don't recommend the patient to have unlimited sugar intake. Okay, let's go to professional tooth cleaning. As we talked about, if tooth cleaning is proper, it can be effective. So we have kinds of programs in which we have professional tooth cleaning with different frequencies. They are named CALSTOT programs. CALSTOT programs has 4 items. The first one is repeated oral hygiene instruction. The second is topical fluoride therapy. The third is dietary counseling. And the fourth is professional tooth cleaning. Here you see the results of CALSTOT program. As you see, it has good effect, and we have it is highly recommended in high-risk patients. It can decrease and reduce the number of caries in patients. The frequency of tooth cleaning by professional person is fortnightly, monthly, or even 2 monthly. It is emphasized that this can be recommended, and it can decrease the caries at the surfaces which are difficult for the patient to toothbrush by himself, but it is rather costly, and it should be used in highly caries active patients. And as concluding remarks, the effectiveness of toothbrushing in caries control is not very high in normal population. However, when the quality of brushing is high, it can be very efficacious process, and tooth cleaning should always be carried out in conjunction with fluoride toothpaste. Okay, I cut the chase, and I go to conclusion that let's join hands to protect our patients and communities from dental caries. Thank you for your attention.
Thank you, Simin. Thank you very much for your nice presentation. Okay, dear students and all of our audience, that was the end of our first session of community oral health. For the first day, we have another session on tomorrow afternoon. We are waiting for you, and we have many other interesting topics to be discussed tomorrow. good day at the moment, and I come back again for tomorrow to see you. Goodbye. Next session will be start very soon.